Yeah, joining me on the home treatment of COVID-19 cases is Dr. Efemena Daniel Onowubeda. He is Registrar Community Health and also a member Edo State COVID-19 response team. Thanks for coming, Dr. Daniel.
Thank you very much.
We look at the reports where the federal government did say that they are having the bed spaces being congested in the country. And looking at that, the possibility of having home treatment of infections cases. Do you think that will all go well? Because the NMA, on the other hand, did say that it is wrong if the federal government goes on this due to the overcrowded nature of houses, which could also excite increase in infections.
Okay, thank you very much. With regards to case management of COVID-19 patients, there have always been two approaches. We have the health facility management and we also have the non-health facility management. As the cases begin to increase, the reality begins to dawn on us that in addition to the health facility management, we also need to have the non-health facility management. So this non-health facility management will take place in regulated places like hotels and certain homes of persons. Yes. For this to occur, the patients in question will have to have met certain criteria before they will qualify for home treatment or facility treatment. Like we have over 4,000 cases of COVID-19 currently in Nigeria, and it's expected that it will still increase as the days go by. We will get to a situation where the facilities on ground will not be able to manage the total number of patients. And we know fully well that over 80% of those infected by COVID-19 are usually asymptomatic or have mild symptoms. Then we have a further, is the 20% that may need hospitalization and may become severe. So how then, at the point it will be, you have to get to a certain stage where you have to take between those who have mild symptoms and those who have severe symptoms, who gets the care. If somebody has a severe symptoms and because of the hospitals being congested, is not able to get care because there are so many people with mild symptoms in the hospital, then it does not make logical sense.
It doesn't?
Yes. So
because he needs the facility of the hospital
exactly,
to survive, being that is severe.
Exactly, since that is severe. So we will have to look at a situation where those with mild conditions are managed either at home or in a regulated facility like an hotel, like I said. Now, what would be the criteria that will make the person qualify to be treated at home? First of all, he has to be shown to that he has mild symptoms or asymptomatic. There are some people that will test positive that are asymptomatic. Some will also come down with just mild symptoms like fever of less than 38 degrees. Some may have catarrh.
Fever of less than 38 degrees?
Yes.
Are you serious?
Degrees Celsius, yes. You can have fever of less than 38 degrees Celsius. We also have catarrh, and some may just have mild cough. Then you have those that don't have any underlying disease. So there's no comorbidity. The person doesn't have probably hypertension, diabetes, or is not somebody that has been frequenting the hospital. So the person is physically fit also. Then also, we also have to look at the social support that will be available to the person. Does the person have people that can actually help him comply with the regulations that will be put in place in the house? So before this is done, a healthcare worker will have to assess the patient and also assess the home or the facility where the patient will be kept in, because you will need to know if they will actually comply with because you don't want this infection to spread. So you want to know if they will comply with the regulations. So what is essentially done is the healthcare worker assesses the facility. Can they self-isolate in this facility? Okay, the person in question, is he willing to self-isolate and will he adhere to the protocols? For example, when you see a patient that clearly understands all what you are saying and will be able to take his medications, will be able to maintain himself in a well-ventilated room in his apartment where others don't come in, then the person minimizes movements into shared spaces like bedrooms and toilets and probably kitchens. Then the family is also able to regularly clean surfaces where they touch, and they maintain their physical distance of at least 2 meters within the house. Then those kind of patients are easy to manage at home. Then you can also say, okay.
Well, it's easier said than done, doctor, because if you look at it, some say that this virus is so lethal to a point that even while making measures to curtail it at home, persons eventually contract the virus. So don't you think that could be the reason why the NMA and the National Association of Nurses and Midwives are against its use?
I understand I'm also an NMA member, and I understand everybody's apprehension towards home management. However,
so what's the guarantee that it can be properly managed at home?
In everything we do, you always have to look at, you have to weigh the pros and cons of whatever decision you take. But the reality on ground is, if the facilities are overwhelmed,
what to do?
And you don't have places to admit severe cases, then how do we now go forward?
Okay.
So you have to when you get to that point, it's because now we're not at that point.
So it's an option that eventually you must deploy.
It's an option that will be eventually deployed. Even in advanced countries like Italy, they got to a point where they made very hard decisions. At the point, they decided in Italy that if you don't have any symptoms, don't come to the hospital.
Okay.
At a point, they said people over 80 will not be placed on ventilators. So at a point, it reduced to those over 60. So you get to a point where you need to make some tough decisions. But we pray we don't get to that point.
We pray that we don't get up to that point. But let's look at the PPEs that should be used at home.
Yes.
Like, for instance, you are putting on a nose mask.
Yes.
There are some that are locally produced here.
Yes.
Do you see those locally produced nose masks as fit?
Okay.
Like if we have a patient, for instance, at home and using those locally produced face masks, is it healthy?
The essence of the face mask is to prevent spread of droplets, to reduce it to the barest minimum.
Reduce it.
Yes. So the face masks that we are currently, especially the cloth face masks that is currently being advocated, because everybody cannot get this medical face mask. So we have, the government has advocated for cloth face masks. That should help to limit this, if properly used. It will help to limit the spread of droplets.
But the pores on the nose masks that are being locally produced seem bigger. Don't you think so?
Yes, they might be bigger. Yes, I don't disagree with you on
which
that.
exposes one.
They might be bigger, but it still helps to reduce than being without a face mask. If two people are wearing a face mask, if I'm wearing a face mask and you're wearing a face mask, even if this cloth face mask, the chance of transmitting the infection from me to you is greatly reduced compared to if both of us are not wearing a face mask, or if I'm the only one wearing a face mask. So that's why the government has been advocating that people should wear face masks everywhere they go.
Okay, in the case you have a patient in someone who is suffering from this at home,
yes,
will you also advise?
No, if somebody is suffering from this at home and the person has mild symptoms, like I told you, one of the very criteria is this person asymptomatic or has mild symptoms?
Yeah, but having mild symptoms or being asymptomatic,
yes,
doesn't stop them from spreading the virus.
He has to wear his face mask.
Okay.
The patient has to wear his face mask while at home. That's why you have to assess the patient himself to see if this patient will actually adhere to the IPC infection prevention and control measures that you have laid to him. If you assess this patient and you realize that this will be a stubborn patient, this patient will not adhere to this patient and the family will break all the rules, that patient does not qualify for home treatment. So you assess the patient, the healthcare worker will assess the patient. It's those that will be compliant that will likely benefit from the home treatment. Okay. Those that have apartments where there are enough rooms will also benefit from this home treatment. There are certain people that will definitely not benefit. For those that stay, for example, in very closed,
in crowded places,
facing I face you,
yes,
it's practically impossible to have home management for those people. So other alternatives will be considered for those kind of people. Okay,
let's look at measures again to reduce exposure.
Yes.
Like some say, experts say that they shouldn't use same cooking utensils with those who have it at home.
Yes.
And then how do you disinfect?
No, they should have a dedicated, like for example, that's why I talked about, do they have adequate social support at home? I don't expect that somebody that's already infected with COVID-19 will be the one cooking his food by himself at home. Somebody has to cook the food.
And you won't share the same kitchen?
But
no, the person wouldn't even get...
Yes, he won't get to the kitchen.
Okay.
Somebody will cook the food and probably bring it to the patient.
In the room?
In his room, in his own ventilated room where he's going to be.
Okay.
And there should be a dedicated kitchen utensil for that kind of person.
Yes.
The plates, the cutleries, everything is going to use should be dedicated for that person. So once the person has finished using it, brings it out, it's washed. We use the commonly available hypochlorites, that's JIC or hypo, to wash all those.
JIC or hypo, okay.
Yes,
yeah, okay.
to wash them, and that will do. So there should be dedicated, even his clothes. When he pulls his linens, his clothes, his bed sheets, there should also be a dedicated place where they are immediately washed with soap, water, hypochlorite, just to...
even if it is a bar soap?
Well, preferably I prefer detergents, but the bar soap will also work. Okay. Yes.
Okay. A situation where some persons are saying that the rate at which some persons are escapees from the isolation centers, some say that it's as a result of the inadequate care that they get in isolation centers. That's the reason why some of them escape. Do you have something to say in that regard?
Well, with regards to the isolation centers, irrespective of how beautiful an isolation center is, isolation center can never be like the home of an individual. Okay. And while I will not say that we are perfect, I believe that the state government has done a lot to make the stay of patients in the isolation center more comfortable. But we have some people that don't seem to understand, and some people still feel that, why will you restrict my... You know, like I told you, many of these people are asymptomatic. So you put somebody in an isolation center, is actually feeling very fine, it's okay, he's not showing any symptom, and the only reason why he's in the isolation center is because his test came out positive for coronavirus. That kind of patient will always feel agitated, because you've taken the very first thing from him, which is his freedom, his ability to move about, do one or two things. So you expect that those kind of patients would be more apprehensive than somebody who is actually sick and is in the same isolation center. Somebody that is actually very sick and is in the same isolation center will be more compliant than somebody who is not showing any symptom and is in the isolation center.
Thank you so much, Daniel, for taking our time to be part of this show.
Thank you very much.
And we hope we have another opportunity to have a chat with you on this issue again.
Thank you very much.
Well, there's much we can take. Next will be insurance segment. Do stay with me.